In this screencast, we're going to talk about the main arteries and veins that lead out of the heart and lead into the heart. We're going to talk about two sets that lead into the heart and two that lead out of the heart. First up, we'll talk about the vena cava. The vena cava is actually two blood vessels. You have the superior vena cava and then the inferior vena cava. To pluralize that word, just add an E to the end of cava, and it's cavae. They are going to drain deoxygenated blood from the body into the right atrium. So the blood that has been circulating around the rest of your body and has given its oxygen away, come back to the heart via these two blood vessels on the right side of the heart. After the blood goes from the right atrium to the right ventricle, it's going to leave via the pulmonary artery. The pulmonary artery starts here with the pulmonary trunk. So it starts as one artery leaving away from the heart, and then it splits into a left and a right. And within that left and right, you actually have two different arteries. So you have two pulmonary arteries that go to the right lung and two pulmonary arteries that go to the left lung. So these arteries are going to carry blood to the lungs so that it can get oxygenated again. The pulmonary veins carry blood from the lungs, so now it's oxygenated, into the left atrium. You have two coming from each lung, just like you had with the arteries. They're going to dump their blood, which is now oxygenated, back into the left atrium. When the blood leaves the heart in order to go be pumped to the rest of the body, it does this via the aorta. So you can see here, you have the aorta comes up here as a nice big arch. It has three main blood vessels that come off it, and then it actually comes back down behind the heart and descends to deliver blood to the lower part of the body. So here's a little chart to summarize this. You can see the right side of the heart is carrying deoxygenated blood. The left side has oxygenated blood, and so that's the blue and the red. On the right side, you have the superior and inferior vena cavae and the pulmonary artery. And then on the left side, the right and pulmonary veins and the aorta. The arteries are the pulmonary artery and the aorta, so they're both going away from the heart from the ventricles. And then the veins, so coming back into the atria, are the vena cavae and the pulmonary veins. Two more things to talk about. The next one is going to be the valves. The valves are contained within the arteries of the heart. So just as within the chambers of the heart, you don't want blood from the ventricles going back into the atria once it's been pumped forwards, you don't want blood draining back into the ventricles or into the heart once it's already left the heart. So these valves prevent backflow into the ventricles. So they're going to be found in the pulmonary trunk of the pulmonary artery and in the aortic valve, in the aorta. So here is a little diagram that we have. So you can see they're just these little flaps. They don't have the whole chordae tendineae and papillary muscles like the AV valves do, but you'll see them here as little flaps. So once the blood goes out, it cannot push open the other direction. If you look at this superior view of the heart, you can see they just sit right here. All of the blood vessels go out of the top of the heart or come into the top of the heart. So when you look here, you can see that even this pulmonary artery, even though it's coming from the ventricles, it comes back out the top, and the same with the aorta. It comes from the left ventricle and goes back out the top. The last thing I'd like to mention is that the heart itself, the muscle of the heart, needs a lot of blood. It needs a really, really good blood supply. And so the heart muscle does not get supplied via these big main arteries the way the rest of the body does. In other words, the heart is not a part of this big loop with all these different stops along the way. It actually has its own little blood supply. And this blood supply is made up of the coronary veins and coronary arteries. In this diagram, you can see that it's a pretty extensive network for the heart, and it has lots of different arteries and lots of different veins. So it's just important to know that the heart has its own blood supply, and it'll drain the deoxygenated blood, drains right back into that right atrium via the coronary sinus, and then the blood gets pumped off of the aorta as well, but it has its own little system. So that is the overview of the 4 major blood vessels, or pairs of blood vessels, that are going into and out of the heart, as well as the valves and the blood supply for the heart itself.